When an emergency strikes, you reach for your first aid kit. But what if it's just a box of cartoon bandages and expired wipes? That false sense of security can be dangerous. Today, we're covering the 5 deadly sins that turn your first aid kit into dead weight. And I'll show you how to fix them so you're actually prepared for when it counts. Sin number 1, overpacking with just-in-case junk. Into almost any big box store and you'll see these shiny first aid kits bragging 200 pieces fully stocked, as if the sheer quantity automatically equals competence. Let's be real. What you actually get is often a disorganized jigsaw puzzle of tiny, practically useless bandages and maybe 3 inches of tape that wouldn't hold a feather, and cotton balls that somehow manage to escape their packing. Overfilling your kit isn't just annoying. It can actively delay critical treatment when seconds truly count. The fix. Strip it to the life-saving tiers. Forget the just-in-case junk and focus on must-have essentials. Think about what truly buys you time and manages immediate threats. Experts recommend prioritizing items that address the most urgent needs. Keep it lean, mean, and effective. Basic first aid supplies. Bandages and dressings, adhesive bandages, waterproof fabric and butterfly closures. Knuckle and fingertip bandages, sterile gauze pads, such as 2x2s, 4x4s, and 5x9s. Non-adherent Tesla dressings. Abdominal pads for trauma dressings. Elastic bandages, such as ACE wraps, various sizes. Hydrocolloid dressings for blisters or burns. Transparent film dressings, such as Tegaderm. Hemostatic dressings, like Quick Caulk or Celox. Burn dressings, like Burn Shield, for wound care. Antiseptic wipes, such as alcohol, iodine, or chlorhexidine. Saline solution, for wound irrigation. A sterile irrigation syringe. Neosporin or Bacitracin. Burn gel or dressings. Steri strips or wound closure strips. Skin glue. Suture, kit, or stapler, if you're trained to use it. Wound packing gauze. Plain and the hemostatic type. For splinting and immobilization. Universal SAM splints. Finger splints. Triangular bandages. Make slings and secure splints. Cervical collar that's adjustable. Pelvic binder, such as a SAM pelvic splint. Traction splint, such as a hair traction. For advanced airway kits. Oral pharyngeal airways of various sizes. Nasal pharyngeal airways of various sizes. A bag valve mask, both pediatric and adult, with oxygen reservoir. A pocket mask with a one-way valve. Non-rebreather masks, both pediatric and adult. Some advanced airway tools. Endotracheal tubes, various sizes. Laryngoscope with a camera, such as a GlideScope or King version. Laryngoscope blades. Supraglottic airway devices, such as a King LT or LMA. Cricothyroidotomy kit. Scalpel boogie tube. End-tidal CO2 detector or other canap-breathing device. Magical forceps. A stylet for innovation. Suction device, manual or battery operated. Suction catheters. For some emergency procedures, needle decompression, large bore needles, 10 gauge and 14 gauge, at least 3 1/4 inch. Vented chest seals. Occlusive dressings for open chest wounds. 5 tourniquets, cat type or soft T. 5 hemostatic agents. Celox or Quick Clot. 5 Israeli bandages or other emergency trauma dressing. 5 pressure bandages. If you have IV access, IV catheters, 18, 20, 22, 24 gauge. IV start kits with alcohol swabs, tourniquet, and tape. Saline flushes. IV fluid, typically normal saline or lactated ringers. If properly trained, an intraosseous access device, otherwise known as Easy IQ. IV extensions and tubings, and an IV hep lock. Surgical set with various sutures. Emergency dental extraction kit. Diagnostic tools includes a stethoscope, blood pressure cuff from pediatric to obese adult, a pulse oximeter, a glucose machine with test strips and lancets, a pen light, and a reflex hammer. Personal protective equipment includes various sizes of Metro gloves, face masks, surgical, and N95, eye protection, goggles or face shield, gowns, hand sanitizer, biohazard bags, a mini sharps container. Miscellaneous supplies include a notepad and pen, waterproof marker, medical reference guide, emergency blankets, like 3 each, headlight or flashlight with extra batteries, chem lights, a multi-tool, duct tape, 550 cord, waterproof bags, a watch with a second hand for checking pulse time. That's it. If it doesn't fit neatly into a gallon freezer bag or well-organized compact container with labeled compartments, it doesn't ride. Multi-use items and deliberate choices beat abundance every single time. Section 2, Sin 2, the one out, never in pack. Oh, I've been there. I've handed my last strip of Leukotape, the good stuff for blisters, to a stranger with a nasty heel blister for a long hike. We're feeling like a real trail hero. No problem, I thought. I'll restock when I get home. Famous last words, right? Next trip. I completely forgot. 2 weeks later, she's limping 10 miles back to the car on a raw, agonizing heel. Me, because my kit was now a sad, empty echo of its former self. Using items without immediate replacement creates dangerous false sense of security. You think you're prepared, but you're really not. Fix. One word, a checklist. Seriously, make a checklist. Tape it to the inside of your kit or keep a digital version on your phone. Columns should include item, quantity, and space for last date used or restocked. When something leaves that pouch, that checklist comes out and it sits on your kitchen counter or wherever you'll see it, like a parking ticket that you'll absolutely have to deal with. It's a visual reminder. It's a visual reminder, a gentle nag until you replace the item. Better yet, keep a tiny backup box at home with 5 of each high-use item. Think bandages, antiseptic wipes, or pain relievers. That way, refills take 30 seconds, not a dedicated store run you'll inevitably postpone. This habit ensures your kit is complete and ready, embodying the one in, one out rule. Section 3, expired equals untrusted. Out-of-date saline flush? It's basically just salt water, right? So incredibly wrong. Once the sterile seal on that saline dies, or if the saline itself degrades, you're not flushing a wound. You're potentially introducing grit, bacteria, and other contaminants into an open wound, setting the stage for a nasty infection. The same goes for weakened painkillers that have lost their potency, leaving you with ineffective relief when you desperately need it, or crusty, ineffective antibiotic ointment that won't protect against infection. Adhesive bandages lose their stickiness. Gloves can degrade and tear, and antiseptic wipes can dry out, rendering them useless. Using expired supplies isn't just ineffective, it can be downright harmful. Fix. Add 2 calendar alerts a year, your birthday and your half birthday. These are your non-negotiable kit audit days. Pop open that pouch, pull out every single item and flip it over. Read the expiration stamp. Don't guess. For anything that will live past next Christmas, grab a Sharpie and write the expiration year in big, bold digits directly on the item's packaging. This makes future checks lightning fast. Implement a first in, first out ruthlessness. Older items get used up for everyday scrapes and minor emergencies around the house, while fresh supplies go into your primary kit. If an item is within 3 months of expiring, move it to your home medicine cabinet for regular use and buy fresh for your emergency kit. This biannual check ensures your supplies are always effective and sterile. Section 4, Sin 4, generic kit, specific body. A generic store-bought first aid kit It's like a one-size-fits-all t-shirt. Technically it fits, but it's probably not comfortable or truly functional for anyone. My buddy, for example, carries an EpiPen for his daughter for her severe allergies. I, on the other hand, have asthma inhalers for myself. Guess whose kit completely forgot both last Memorial Day weekend? Mine. A generic kit has no idea about your allergies, your kid's diabetes, or your loved canine companion needs a specific Benadryl dose by weight for bee sticks. I won't know about chronic conditions, specific medication, or even the unique risks of your activities, like blister prevention for hikers or eye wash for dusty environments. Fix it. Build a topper pouch. This is your personalized critical info hub. Grab 1-gallon plastic bag and label it clear, personal. Inside, you'll stash any prescription medicines you or your regular companions need. Think 2 days worth minimum. Crucially, include a laminated card with doses, known allergies, and emergency contacts, including their phone numbers and your blood type. This personal pouch is dynamic. You swap its contents every season, just like you swap your wardrobe, ensuring meds are current and relevant. If you regularly hike or travel with a partner, trade these personalized cards and ensure that they know where yours is. That way, if one of you becomes unconscious or incapacitated, the other can speak for them with vital medical information. Consider adding specific items to your environment or activities, like moleskin for hikers, a dental repair kit for remote trips, or even N95 masks if you're concerned about air quality during disasters. Sin 5, holding it like pirate treasure. Where do you keep your first aid kit? Car glove box in August? That's basically a microwave. Frying your medication and adhesives. Bathroom cupboard above the steamy shower? Welcome to a petri dish where humidity compromises sterile packaging and encourages mold. For years, I kept mine buried in the basement junk drawer, about 28 steps and a flight of stairs from the front door. When the lawnmower decided to take a bite out of my ankle, that kit might as well have been stored on Mars. Inaccessibility, extreme temperature, and humidity are the enemies of an effective first aid kit. Fix. Live by the 30-second rule. From any spot in your house or your car, you should be able to lay hands on that kit in half a minute or less. Period. It needs to be cool, dry, and visible. Think about eye-level shelf in the kitchen pantry, a dedicated hook in the hallway, or secured in a cargo net in a shaded trunk of your car, not in the glove box. If you have multiple kits, ensure they're all stored optimally. Crucially, make sure every regular occupant, every family member, every housemate knows exactly where it is. Kids old enough to slice bagels are old enough to know where to fetch the kit in emergency. Choose a sturdy, durable, and preferably waterproof container to protect the contents from dust, moisture, and impact. Clear containers or labeled compartments can dramatically improve quick access in a high-stress moment. All right, quick reality check. If you've been nodding along, maybe even pause to count how many of these sins you personally are guilty of, and hit that like button. Seriously, help YouTube show this video to the next hiker, the next parent, or the next warrior before they learn these lessons the hard way. Gear without know-how is just expensive clutter, a false promise. Your emergency medical kit could save a life or become a liability. If you're making these 5 common mistakes, watch my video. 5 IFAC mistakes that kill. Shows you how to avoid fatal errors that keep your family safe when seconds count. Straight from real battlefield experience. Section 6, the happy ending, part 2. Back on the trail, my foot snagged that root. I'm not proud of what happened next. I cinched my belt down around the wound, jammed a cleanish sock into the gash, and hobbled for 2 agonizing wires. Conclusion. Let's recap these 5 critical takeaways before you click away, armed with knowledge to upgrade your preparedness. Purge the junk. Slim down your kit to only what you truly buys you time and manages immediate threats. Quality over quantity. Always. Restock relentlessly. The second you use something, replace it. Make it a habit. Your checklist is your best friend here. Expiration dates aren't polite suggestions. They're hard headlines. Check them, mark them, and rotate your stock. Personalize your pouch. Your body, your family, your activities, they all have unique needs. Generic won't cut it. Store it smart. Your kit needs to be cool, dry, visible, and reachable in 30 seconds by anyone who might need it. No pirate treasure hiding. Do these 5 things, and your first aid kit stops being a hopeful security blanket and starts being a legitimate life-saving tool. If this video keeps even one of you from staring at a deep cut and cursing a pocket full of pointless cotton balls, it's done its job. Share it with that friend who still brags about their 250-piece kit they bought in 2012. Then go open your pouch. Give it an honest audit. Your future self, maybe even a future spouse, kid, or that random stranger on the trail will absolutely thank you when those seconds truly matter. Stay tuned for part 2 where we'll discuss medicine supplies and your medic bag. This is survival. This is resilience. This is Suburban Prepper.